Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Happy day, welcome back to Healthy Living. Tonight we are talking about a sensitive topic that some may be uncomfortable discussing with their partner, their family members and friends, or even their own doctor. But sexually transmitted diseases are becoming a major problem on Guam as the number of individuals diagnosed with STDs is growing each year. And the number of young people on Guam who have gonorrhea and syphilis is a huge concern. Here to tell us about STDs and ways you can protect yourself from getting them is our favorite doctor who provides a wealth of knowledge on these topics, Express Care's Dr. Jitka Lom. Thanks for joining us, Doc. So what are STDs? And, you know, I think most people know, but how do you get them?
Okay. Well, you don't get them from the toilet seat. Okay. So sexually transmitted diseases are infections in the private parts. They can be bacteria, viruses, or parasites, and you catch them from having intercourse with another person.
Now, there's so many different types, but I know I mentioned in the intro just some of the more prevalent ones.
On Guam, we have chlamydia. It's a huge, huge problem. We have genital herpes. We have warts, genital warts, syphilis, and gonorrhea. Those would be our top 5.
Okay, so for people that don't know what they are, briefly break down what those are.
So chlamydia is a bacterial infection. It gives men slight discharge and women slight discharge sometimes. Other times they can be very silent, but it can mainly cause infertility in women. That's the big problem there. Okay, now gonorrhea is another bacterial infection. It causes a green discharge from men and women, and it can also affect your mouth and give you really very nasty discharge in your mouth. A very contagious disease and can be treated with antibiotics. Chlamydia can also be treated with antibiotics. Herpes is a viral infection. It gives you blisters on your private parts. You can imagine how painful that is. And it's a lifelong infection that is going to be there for your life in outbreaks periodically. And it can be controlled with medicine. And then we have syphilis. That's caused by a bacteria also, and it can give you sores on the private parts. And it can also affect your nervous system. So in the old days, people, like this is 100 years ago, people would get neurosyphilis, where 20 years after getting their first sore on their private part, they actually developed brain problems and dementia, and actually died of syphilis. Some of the famous composers died of syphilis. So that was that. Did I miss one? Oh yeah, genital warts. Okay, those are also caused by a virus called the HPV virus, and there's a vaccine now that we'll probably talk about that you can get to prevent that. But warts basically are little bumps on the private parts, and they can sometimes be big and very like cauliflower almost, or other times they can just be a little tiny bump. They're contagious. And the risk there is that the wart virus can also cause cervical cancer in women.
Okay. Now, all of this is a result of unprotected sex.
Pretty much, yep. You know, people tend to be in denial, like maybe I caught it somehow, some other way. But the truth is, it was from sex. So just as you perhaps wouldn't kiss somebody with a strep throat, you should check out and see who you're sleeping with so that you don't catch something you don't want.
Or protect yourself, for sure. Now, how does somebody treat STDs? You were mentioning antibiotics for some of them, and then some of them you said were lifelong.
Yeah, so the bacterial ones, that would be the syphilis, the chlamydia, and the gonorrhea. Those we can treat. You come in, you get a single dose of medication, you're done, you're finished. Your partner also has to be treated, and it takes a little while for it to work, so 2 or 3 days down the road, it's over. Okay, but as far as the viral ones like the herpes and the genital warts, and then maybe HIV also, we can talk about that as an STD. That one is there for life, and it can be sometimes controlled or managed, but it's going to be bothering you forever.
Now, how would somebody know if they have it? And, you know, is there like an STD test that'll say, okay, you do something and then it tests you for all of them?
Yes, it's really simple. If you have no symptoms at all, which every day we see people that come into the clinic who have symptoms and they want testing. But other times, if you have no symptoms at all, it's a simple blood test and a urine test. We just need a little bit of blood and a little bit of urine, and we can check for all of those different diseases. And insurance will cover that. If you don't have insurance, you can either self-pay at the lab. To check for all of that, including HIV, costs around $100. Otherwise, you can go to public health and have it done for free.
Okay, and also for women, regular pap smears, right, would help detect
That's for
this?
sure. So especially for women who don't have a regular or like a steady long-term partner, let's say, they've had multiple partners, you better get a checkup every year. We'll do your pap smear and we'll at the same time check for those diseases because they can be silent.
Okay. Now, like most diseases, prevention is key.
Yeah.
How can someone prevent contracting an STD?
So I think safe sex would be the thing to say here. Using condoms is incredibly important. Condoms will protect you from all of those diseases if they're used properly, and they have to be used for them to work. And then as far as knowing your partner, this is also very important. And everyone's a sexual being, but you do not have to be a promiscuous being. So I think for you to know that it's not necessary to overdo it.
Okay, and that's leading into my last question before we throw it a break here is, I'm sure you've seen some really horrible cases at the clinic. What can you say to discourage young people out there? Because we are seeing numbers of STDs in young people really on the rise. What could you say to young people to discourage them from having unprotected sex?
Well, I'd say a couple of things. First of all, condoms are cool. If you're a man and you're offering to use a condom, then you're showing respect for your woman, and she's going to appreciate that and will care for you even more. And as far as women, you need to show respect for yourself and insist on the use of a condom. If somebody won't use a condom with you, then that's a clear indication of what kind of person that is and whether they have the respect that you deserve for you. And I think as far as having a conversation with your partner, that's really important. Having the courage to say, let's get tested before we do anything, especially for young people. That's just so important. Because I hear it all the time. People come in, they say, but he told me he didn't have anything, or he told me that he doesn't have any other partners. But see, you don't know that for sure, so you better get checked first and have your partner checked first. It's a simple thing, blood test, urine test, and you have a piece of paper that says you're clean and that he's clean, and then go forward.
Okay, or of course the other option is abstinence.
Well, that's true, and of course, and that goes without saying. Thank you. Of course.
All right, well, we have to break away, but we will pick up our discussion on STDs when Healthy Living returns. Stay with us.